Hi, everyone. Thank you so much for joining us and watching just a brief conversation. Dr. Tisch, I'm going to turn it over to you and have you start introducing yourself, and then we're going to launch into just a conversation about Case Western Reserve's dual degree, Masters of Public Health and Masters in Bioethics and Medical Humanities programs.
Thank you so much, Dr. Jeunnette. My name is Daniel Tisch. I'm the director of the Masters of Public Health program and professor of Population and Quantitative Health Sciences here at Case Western Reserve University School of Medicine. I myself am a trained epidemiologist. I have a PhD in epidemiology and biostatistics, but I also have a Masters of Public Health degree, which is why we're talking here today about the intersection between public health and bioethics. For this discussion, I will be sharing my expertise at the intersection of public health research and practice as it relates to your interest in this dual degree. Dr. Jeunnette, would you like to introduce yourself?
Sure. So I'm Leah Jeunnette. I am the director of the Masters in Bioethics and Medical Humanities program here at Case Western Reserve. I also, similar to Dr. Tisch, I have a master's in bioethics. So it's very fitting that we're both directors of programs that we have degrees in. So we both have a lot to say about the value of those degrees. My background is actually focused in bioethics. So I have a PhD in healthcare ethics, really focusing in on clinical ethics, so ethics in the hospital systems, and also focusing in adolescent medicine. So I think what's interesting about this dual degree program is it's a very natural fit of like two areas of expertise. And so I think it's important to kind of outline those areas. So, Dr. Tisch, to start, why study public health?
Hmm. That's a great question. And clearly, if somebody's listening to this, they already have a strong interest in this field of expertise. And I think that if for those who have an inkling of interest, what I found is that there's a very strong link to the field of public health. And what does that mean? It means that individuals have an interest in developing very clear skill sets around knowledge and analyses and practices, professional public health practice to improve the health of our communities. And now that's a pretty broad concept, improving health of our communities. But public health is really aligned in the medical fields, but it's different than medicine. It's really around prevention, and it's around topics that affect the health of individuals and communities. So I know I myself was interested in it because I've always been interested in my area of expertise is infectious disease epidemiology. And infectious diseases by nature apply to public health, whether it's preventing transmission within communities or vaccines. Vaccines, by definition, are a public health intervention. And so it was a natural fit for my particular interests as I progressed through my career. But there's also social epidemiology, which is also in line with my area of expertise. And there's many subspecialties within this big umbrella of public health, ranging from policy, health policy, health management, for which we have a concentration in our program, global health, which encompasses both international health and diseases that are relevant globally. We have expertise in that as an entire institution. We're world renowned for our global health work. Health promotion, disease prevention. So, for example, smoking cessation, tobacco elimination programs, food security, uh, um, and other community health impact focus topics would fall under that. And we also, as an institution, as an R1 research institution, we are known for our research expertise. In fact, our public health program has an entire concentration devoted just to population health research. Dr. Jeunnette, I think I'd like to hear a little bit about your thoughts on the bioethics side of this question.
Sure. So when I will say I get the question all the time of like, what is bioethics? Because it's maybe not as well known as public health. And so when I think of bioethics and medical humanities, we really think about kind of the non-biological aspects of health and medicine. So for bioethics specifically, right, the ethics of healthcare, the ethics of medicine, the ethics of public health, population health, global health. Um, and when we think of medical humanities, it's really the human element, the non science portion of medicine. And so it's a value part of this like larger concept of healthcare, health, medicine, which public health is also a part of. Um, when we think of bioethics, in different areas that students often are familiar with, it's things like end of life decisions, right? What kind of decisions do you make about removing, a ventilator from someone, or thinking about having to make decisions on behalf of your loved ones because they can't make decisions for themselves at end of life. Maybe it's resource issues, resource allocation. There's only so much supply to go around. Hospitals, communities, um, you know, only have a finite number of resources. As much as we like to think that there's a lot to go around, at some point we do have to make decisions of person A gets something, which means person B doesn't. Um, I think during the pandemic specifically, we saw a lot of discussion of ethics, right? Controversies of masks and vaccines, behavior, policy. And I think it was maybe the first time, at least in my lifetime, that I can remember that bioethics and really ethics and public health were at the forefront of these discussions, like in step with each other, right? You couldn't have a conversation about vaccines without talking about the ethics and how we distribute the vaccines and requirements or not having to be mandated and those kind of things. I would also say that there's an area of research, right? So how do we establish policy? Who gets to sit at the table and who's missing from the table to help determine policy and apply the policies that we're creating and ensuring that it's, equitable and fair in these things. And the involvement of individual human beliefs and behavior and how that affects our decision making and how we kind of approach these things. So I would say there's a lot of overlap between the public health questions that are being asked and then coming alongside it and saying, like, how are we doing it? Why are we doing it? Not just can we do it?
Mhm.
And so I think there's a natural fit between public health and bioethics and medical humanities.
I
So,
agree. I
so
agree. And I was going to add, if I
yeah,
may, and transition a little bit, that I think that this idea of this intersection, this overlap, this intersection, what I'd like to highlight here is that while they intersect so strongly, and the example of COVID, we shared grants and research activities across our programs between bioethics and public health as that example, and we had active research in that area because they fit so well together. But I do want to point out that they have unique skill sets
they
and
do.
unique perspectives, and that's important because having both the bioethics training and the MPH training are unique, but they integrate into something much more powerful.
Yes, I think that's an excellent point that they do have unique skill sets by themselves, but together it really allows students to kind of flourish. So speaking of the two things together, what makes the dual degree program here at Case Western Reserve so unique?
Well, I think that the fact that we are a highly respected R1 research institution and we are both in a school of medicine is something that sets us apart from other programs for this dual degree. Now, people on this audience might be wondering, well, what's different about that? Why is that different? Well, from my discipline in the field of public health, um, many of my colleagues are in schools of public health. Now, that has advantages and disadvantages. I think you know where my perspective lies and where I've chosen to work. I think being in a school of medicine is much more powerful, especially in alignment with our research and especially in alignment with our bioethics program. This is a unique setting to be able to be housed in the same school of medicine with all those clinical affiliations and faculty who participate in our program, research opportunities, training opportunities, career advancement. This is an ideal setting for this type of training. I'll also say that our research focus will is ideal for this type of dual degree. And you might be thinking to yourself, what do you mean research? Dr. Tisch, you mentioned clinical, you might be thinking of clinical trials. And yes, I do clinical trials. I do all sorts of trials. We test interventions, drugs, vaccines, those types of things. But research can expand to policy. So research on policy is a valid area of research, which some of our dual degree students have really excelled with and have gone on to law school and in active academic careers. Also, the clinical components, maybe I'd better let you address that side of that.
Yeah. So before I answer the clinical thing, though, I do want to echo what Dr. Tisch said about uniquely being in a school of medicine. So we are the only department of bioethics in a school of medicine in the country because most of the time it's a center for bioethics underneath a philosophy department. Sometimes we're in schools of public health. And so in the bioethics world, we are unique and I think in a lot of ways we're pioneers in terms of being in that space, and students really value that being under that heading of a school of medicine, which then allows us to have great clinical opportunities for students. Within our Master's in Bioethics and Medical Humanities program, we offer something called clinical ethics rotations. So students spend approximately 160 hours rotating, attending things like morning ICU rounds, interdisciplinary rounds, going to IRB meetings, ethics committee meetings, transplant selection meetings. They can go one-on-one with physicians, nurses, chaplains, social workers to really see what the clinical setting looks like. I think what's interesting, especially for our students who are in the dual degree with public health, they then are starting to see this connection between like community health and really looking at kind of population and its relationship to individual clinical care because those things overlap in many ways. And so I think that that connection is very strong when you have the experience of seeing what a hospital is like, kind of behind the scenes, right? Beyond being a patient or just shadowing a physician, which is well and good, but there's more than just physicians at a hospital.
That's great. And in addition to those clinical rotations, as part of the MPH program, these applied practice-based experiences would be integrated. There would also be a practicum as part of the MPH program that could be done also in hospital settings or public health settings or community-based settings, whether that's in Cleveland and Northeast Ohio, across the country or around the world. We had some students working in Nicaragua this last year. We've had students in Kenya, Uganda, um, Papua New Guinea, all around the world. So it's just an incredible uh, opportunity for our students to tailor their training not just to integrate across these two disciplines of bioethics and public health, but to your particular professional objectives and interests.
So, where do students go after they finish the dual degree program? Where are alumni?
Hmm. Well, our alumni do very well from Case Western Reserve University. We're very proud to think of ourselves as a leadership-focused program. And one of the reasons we can call ourselves that is because we're so focused on those leadership development skills. It also helps that we have such strong dual degree programs like this. So, by nature of having a dual degree, these are individuals who are professionally focused, who are integrating across professional disciplines, and are naturally inclined to move forward to leadership opportunities because these types of leadership opportunities are more available to individuals who are able to integrate across disciplines and have these dual graduate degrees and in integrating these professional skill sets. So I'd say that our alumni have gone on to natural professional practices. Many have gone on to law school. Many have gone on to PhD programs. Um, we have quite a few that have found positions within academia at research institutions, some even our own,
Yeah.
and others elsewhere. And my experience is that our students have done exceptionally well. I think of one student in particular who was able to obtain her dream job with USAID. This is what she always wanted to do, and it was just a perfect job. As you know, there's been a little instability in terms of global health and these types of positions. But I will say that because her students are so well placed, she was able to land very well after after things became a little unstable in terms of USAID, and she's working with a Cleveland housing network and has truly integrated across these disciplines to advance that public health initiative and has been successful in helping that organization achieve grant funding and success.
That's great. I love hearing where our alums go, and they, exactly to Dr. Tisch's point, they go on to do great things. And we're so proud of them.
Would you like to share any other perspectives or alumni or outcomes?
Yeah. So, you mentioned that some alumni actually go into academia,
Mhm.
and they work on grants. They contribute to policy.
Mhm.
I know we've had students go on to work for lobbyists and folks kind of in the DC space because they believe that, policy work is important. And so I think bringing two skill sets, two areas of expertise, really allows them to speak with authority when it comes to policy change and things, especially in the kind of the government space. It's a lot of hard work that goes into that. And so we have students that definitely thrive in that area.
That's right. And I think we should also mention that there's these are professional skill sets, and there's a practice side as well. So whether it's uh, practicing within public health departments or agencies, or practicing on the clinical side of bioethics, right?
Absolutely. Yeah.
Yeah. So, Dr. Jeunnette, would you like to share any information for those who would like to apply to our dual degree program?
Yeah. So both programs are still taking applications for this fall. So if a student wants to join us, there is still time to submit an application. I will say that approximately 2.5 years to complete the dual degree. So just keep that in mind. There's a back and forth between taking classes. Sometimes some semesters focus on bioethics, others focus on public health, and sometimes you're taking classes from both. And so it's important to kind of keep that time frame in mind. But there's an online application that can be completed. Both programs require unofficial transcripts. Either a CV or a resume, whatever format you have is fine. The idea behind submitting a CV or a resume is so we can kind of see what experience you've had that's relevant. Letters of recommendation. So I know the public health requires 3 letters. We only require 2, but they could be the same letters. So it's not like you have to get 5 letters. You could do the 3 for MPH, and 2 of them can also count for the bioethics. We require a statement of purpose. What I recommend for students applying to a dual degree is write one statement of purpose for both programs, highlighting why you're interested in the dual degree, why you want to study both public health and bioethics, and how you're hoping to utilize it in your career path. Um, I believe there's a reflection essay for the MPH program as well. And then there is an application fee. I will give an email at the end of our conversation, and you could welcome to email us and we can give some fee waivers to help with that, to offset that cost. And then the last thing is test scores. So any type of graduate test score, those are optional for both programs. So we do not require an MCAT or an LSAT or a GRE. If you have those scores and you want to include them, you are welcome to, but they are not required. And I tell students, like, don't spend the time studying and the money just to submit it for our application's sake. Um, Anything you want to add, Dr. Tisch, about the application requirements? Can you
Sure.
maybe expand on what the reflection essay is for the MPH side?
I think you've described that very well.
Okay.
We simply want to understand your academic background, any relevant experience that you've had as a volunteer, work experience, et cetera. But most importantly, what we're looking at when, at least I can speak for myself, when I'm
Yeah.
looking at applications, I'm not just looking at where you're at now. I'm trying to imagine where you're going to be after this training. There's a reason why you're coming to a graduate program in this dual degree program is because you want to gain the skill sets and theory and perspectives so that you can go on and become leaders at this intersection of these disciplines and have an impact on health and clinical care, et cetera. So that's what we're looking to. We're looking for that trajectory. We're trying to understand how will our program help you achieve that professional goal and to the benefit of our communities. The only other thing I'd like to add to this application side is that it can be confusing. And part of it is our program's fault. You're going to go to our website and you're going to see, well, I can apply through Sophus, or I can apply through this, or I can apply through this. It gets a little confusing. You do not need to apply through Sophus, which is a national application system for the MPH program, if you're just applying to the dual degree with us. There's an alternative pathway, which is a little faster, a little bit easier. But what I want to communicate to you is that we're a friendly bunch. Okay, we are here to help you. So as you are getting ready to apply, you can contact the email or phone number on our website, and we're happy to answer any questions you have. Am I applying the right direction? Is this the right thing I should be doing? What should I put in this letter? We're happy to talk to you and answer those questions.
We'll, as we're kind of wrapping up, we'll put some information on the screen with email addresses, bioethics@case.edu, mph-info@case.edu. You can always email one and then we can loop in the other, not a problem for that. And then we'll put a QR code on the screen that'll take you to application information as well, so that students have a better sense of what web pages to look at, where to kind of start with the application process. The last thing I will say with the application, deadlines, like, right? So we still have time to apply, but we also want to be aware of deadlines. So the Bioethics and Medical Humanities deadline is August 1st. If you intend to start this fall, I believe the MPH deadline is August 3rd. What I would recommend is you can start one application and you can copy your materials over to the other. So it's not like doing two separate applications entirely independent. You can copy things over, which helps with that. The other thing I always recommend for students when you're working on an application, identify who you want to write your letters of recommendation right away. Put their names into the application so that they can get started while you're doing the rest of the application. Because it always seems the letters take the longest to come through. So that's my other recommendation. Any final thoughts, Dr. Tisch, for someone who wants to apply to the dual degree MPH MA program?
Just that we have something very special here, and we would love for you to join us. And we look forward to receiving your application.
Thank you so much, Dr. Tisch. I appreciated having this conversation with you about the dual degree, and I hope folks apply.
Thank you, Dr. Jeunnette. Thanks, everyone, for joining us.
Bye.